Today I want to speak about the role of dental hygienist in a dental team. First of all, let us see who is a dental hygienist. Many people don't know even this, that there exists another team member very important who is known as dental hygienist, and he is a qualified person. He has done diploma in dental hygiene, and as the name implies that he is responsible for the overall dental hygiene, or we should say oral hygiene of an individual. Oral hygiene is very important integral part of our general well-being, because there are many diseases who have their oral manifestations, and when the dental hygienist is looking into a patient's mouth, he can identify those and then can further refer it to the concerned specialist for the needful treatment. Similarly, many oral ailments have systemic implications. There also dental hygienist can play a big role and is playing a big role. Next, let us see which are the services that are being provided by dental hygienists. Dental hygienists are providing preventive, promotive, therapeutic and health educative duties. First of all, they are concerned with complete oral prophylaxis of a patient's mouth, means taking care of all the gum disease and all this, polishing. Then they are doing some fillings also, temporary fillings. They are doing extractions of mobile teeth under surface anesthesia by putting some spray and all this ointments, which make the gums numb, and then they take out the mobile teeth and all this. Very important part of the dental hygienist is contributing towards the overall health of individuals, and he is contributing towards the oral hygiene of the nation. A question may crop up that what is the role of dental hygienist in preventive dentistry? I would say they have a great role in preventive dentistry, because unfortunately most of the dental diseases like dental caries, periodontal disease, gum disease we say, even oral cancers are very painless to start with, but as they progress they cause symptoms, and by that time mostly the disease has already reached an advanced stage, and sometimes the concerned specialist is able to properly manage them. Sometimes the results can't be that promising because already a lot of time has been wasted. But when a person is coming to the dental hygienist for his dental hygiene, for gum problem and for tartars, calculus, plaque, or knowing the correct way of brushing, the dental hygienist is looking into his overall mouth. He is seeing there is some cavity, some periodontal disease, he is addicted to some tobacco product, brushing is done in a wrong way. He notices a lot of things. This is just to name a few. Then he properly motivates them. He counsels them that you have to correct your brushing, you have to leave the tobacco habits. And the patients, when they are with the dental hygienist, they are very receptive. They are in a very receptive frame of mind. They accept what he is telling them, and then it plays a big role in tobacco cessation programs, in keeping their mouth clean. You see, when a person gets into the habit of keeping the mouth clean, then his overall hygiene also improves. It is a matter of common observation. And similarly in dental health education also, they are playing a big role in school camp, checkup of school children. They are contributing a lot. The children in a budding stage, when they happen to learn basics of oral hygiene from a friendly fellow, they try to follow him what he is saying, and it is a great thing. And at a very tender age, he is telling them the harmful effects of tobacco, bidi smoking, gutka and all this. So the children, they are great followers. They follow each and every word. So I would say that in Indian context particularly, where there is urban bias, concentration of dentists in urban areas is quite high. While rural areas, while semi-urban areas, qualified dental surgeons are not that easily available. Dentist population ratio is not that promising. At those places, the quacks are doing a great disservice to the masses. They are just spoiling oral health of the masses. So in such situations also, dental hygienist can play a big role in educating the masses that this is right, this is wrong, this way you have to take care of your oral health, this is the correct way. Just rubbing your teeth with charcoal, just rubbing your teeth with powdered tobacco, with any unspecified material can just abrade the teeth. These are the great roles, great preventive service that dental hygienists are providing. Of course, they are just helping national tobacco program, I would definitely say, by motivating, by counseling their patients in leaving the tobacco habits and just enjoying a very fresh breath. I am here reminded of one incident many years ago. I was listening to a former director of Tata Memorial Hospital, Tata Cancer Hospital in Mumbai. You see, a very great thing he told to the audience, that if we teach correct way of brushing to the person, and if we are able to influence a person to brush in the night, then the incidence of oral cancer, mouth cancer, will come down to the half. Such a great statement coming from a great oncologist, cancer specialist. He was saying that we all know that cancer or mouth cancer is one of the biggest killers in our country, because people are addicted to various forms of tobacco. Bidi, smoking, gutka, pan masala, meshri, canny, all that stuff. It is just playing havoc with our masses' health. So he was saying that it is very unlikely, if a person has brushed nicely before going to bed, then he will try to take some gutka or some tobacco lime mixture and put it into his mouth. We have just discussed that dental hygienist, being a very important component of dental team, is playing a pivotal role in the dental health of the masses. Worldwide he is playing a big role. But so far as Indian conditions are concerned, where the prevalence and incidence of gum diseases, oral health disturbances is very high, so I would say that wherever there is a dental surgeon, along with him a dental hygienist must be available. Even at PhD level, a dental hygienist has to be there, should be there. But now something is very painful to me, that when we see at nursing profession or profession of physiotherapy or pharmacy, we find that so much advancements have been made in their education. There are degree courses, there are post-graduation courses, but in dental hygienist only diploma is there. So I feel that there is urgent need to start degree courses in this country. In foreign countries, degree courses, post-graduation degree courses of dental hygienists are there. Along with this, the dental hygienist should be sent for regular workshops, continuing dental education programs, their conferences. By all means, they should be encouraged to update their knowledge, because ultimately it will be translated into providing outstanding oral hygiene messages to the patients. Thanks.